EMT MCQ questions and answers with explanation. 35 tricky questions. Question 1. A patient has a rash after exposure to poison oak. They have a peanut allergy and an EpiPen. What is the first action? Administer epinephrine. Administer oxygen. Listen to lung sounds. Wash the rash. You must determine if it's a local reaction or systemic anaphylaxis first. Lung sounds help check for bronchospasm. Question 2. What is the most effective way to prevent the spread of infectious disease? Gloves, hand washing, goggles, vaccinations. Hand washing is the single most effective method. Question 3. A patient has fever, night sweats, and is coughing up blood. You should first give oxygen, take blood pressure, put on a HEPA/N95 mask, auscultate lungs. These are classic signs of tuberculosis. BSI/PPE, HEPA mask, is the priority. Question 4. A 12-year-old diabetic is unresponsive with gurgling in the airway. What is the first action? Give oral glucose. Obtain vitals. Suction the airway. Insert OPA. Airway, suctioning, takes priority over everything else when gurgling is present. Question 5. What happens when blood glucose levels fall below 70 mg/dl? Insulin secretion increases. Glucagon secretion increases. Type 2 diabetes develops. Blood pressure rises. The body releases glucagon to trigger the release of stored glucose. Question 6. A 6-month-old has fever, tachypnea, and wheezing in all lobes. What do you suspect? Croup, epiglottitis, bronchiolitis, pneumonia. Bronchiolitis is common in infants and presents with widespread wheezing. Question 7. Which pulse should be checked in an unresponsive infant? Radial, carotid, brachial, femoral. The brachial pulse is the standard for infants. Question 8. A patient is in tripod position. This indicates abdominal pain, respiratory distress, hypotension, chest pain. Leaning forward to use accessory muscles is a sign of significant respiratory distress. Question 9. The golden hour refers to the time from arrival at hospital to surgery, injury to definitive care, dispatch to arrival on scene, start of CPR to ROSC. It represents the critical window for trauma survival. Question 10. Which rhythm does an AED shock? Asystole, pulseless electrical activity, P. Ventricular fibrillation, normal sinus rhythm. AEDs shock VFib and pulseless VTach. Question 11. What is the depth of chest compressions for an adult? 1 to 1.5 inches, 2 to 2.4 inches, 3 inches, as deep as possible. AHA guidelines specify 2 to 2.4 inches, 5 to 6 centimeters. Question 12. In a multi-casualty incident, MCI, a patient with red tag needs immediate care, delayed care, minimal care, no care, deceased. Red indicates immediate life-threatening injuries. Question 13. A patient has a sucking chest wound. What dressing should be applied? Dry sterile dressing, occlusive dressing taped on 3 sides, wet to dry dressing, tourniquet. An occlusive dressing taped on 3 sides allows air to escape but not enter. Question 14. The rule of nines is used to estimate GCS score, percentage of body surface area burned, severity of stroke, for fluid rate. It divides the body into sections of 9% for burn assessment. Question 15. Which sign is specific to a tension pneumothorax? Shortness of breath, tachycardia, tracheal deviation, Chest pain. Tracheal deviation is a late, specific sign of tension pneumothorax. Question 16. What is the ratio of compressions to breaths in 2 rescuer CPR for a child? 30:2, 15:2, 5:1, 10:1. For children/infants with 2 rescuers, the ratio is 15:2. Question 17. Nitroglycerin is contraindicated if the patient has a systolic BP below 120 mmHg, 100 mmHg, 90 mmHg, 80 mmHg. NTG should generally not be given if SBP 90 to 100 mmHg. Question 18. An OPA is measured from the corner of the mouth to the earlobe, midline of the chin, nose, trachea. The distance from the corner of the mouth to the earlobe/angle of the jaw. Question 19. A patient has cool, clammy skin and a rapid, thready pulse. They are likely in septic shock, hypovolemic shock, neurogenic shock, anaphylactic shock. Tachycardia and pale/cool/moist skin are classic signs of compensated hypovolemic shock. Question 20. What is the first step in the primary assessment? Check vitals. Form a general impression. Check for pulse. Open the airway. The primary assessment begins with the general impression.